Good evening, and thank you for staying until the end. I've been asked to invite you on a journey tonight, out into the wilderness of rural British Columbia, a place where beautiful makes beautiful British Columbia, a journey of hope. I've been asked to represent in 6 minutes and 40 seconds 600,000 people, 1,800 doctors, hundreds of nurse practitioners, thousands of paramedics and allied health professionals who live and work in the area. I am but one of these physicians working in isolated environments with limited resources, providing full service family practice and emergency care. I personally don't have a special degree in emergency medicine. I don't have a particular penchant for rural medicine, but there I've been the last 10 years. And that's where I want to start today, to show my hospital in Hope, BC. It's an 8-bed hospital. Doesn't look as impressive as St. Paul's. Doesn't look impressive like VGH, but yet that's where myself and my colleagues provide care. I hope you will see my hopes for healthcare as I recount the story of Elizabeth. Now, to some of you, this x-ray looks like someone's lungs. A few of you say, oh, this is obviously a chest x-ray. And to a small number of you, you recognize this is a tension pneumothorax, and this patient is near death. Today, when I met Elizabeth, was not the first time I met Elizabeth. I had met her 3 years prior in Anderson Creek Clinic, a First Nations health center, started in 2009. This is a partnership between 2 health authorities, including FNHA, Fraser Health, the local band, family physicians, and nurse practitioners. It provides the only clinic once a week to the community of Boston Bar. It was in this office where her and I first met. She was in her 70s and had smoked for the last 55 years. She had not seen a doctor for almost 3 years as the doctor had left town. It was in this exam room that she told me I was the damn doctor that gave her emphysema. I was also the doctor who gave her a flu shot. I was also the doctor who gave her a prescription for puffers, and also the doctor who got her started on home oxygen. However, the day that I met her in the emergency room, she had a trouble. She had an exacerbation of her emphysema, and she was critically ill. She called the ambulance to take her down to the hospital. A rookie ambulance crew, which is often the case in rural BC, traveled the treacherous highway 65 kilometers down the road. They were able to give her oxygen. They were able to give her comfort that they would be at the hospital soon. At our hospital, fortunately, we've been able to recruit and retain staff to keep it open 24/7, 365, unlike lots of the hospitals out there. When she arrived, she was greeted by our one nurse who was on that night, who called me the doctor on call. I quickly went to see her, recognizing who it was and knowing that she wanted everything done. This includes putting a chest tube in her lung to fix it. This including intubating her, putting her on the ventilator, and essentially getting her on life support. Now, we hope we can stabilize Elizabeth quickly, and in a perfect world, she would be transported via air ambulance to another local hospital which has an ICU. Alas, this day, like many other days, there wasn't a critical transport team and there wasn't a chopper available. So myself, one nurse, and 2 paramedics got in the back of the ambulance down more mountainous roads another 55 kilometers away to get Elizabeth into the intensive care unit. Now, fortunately at this point, she's sedated, she has a breathing tube in, and her breathing is eased on the ventilator. A few days later, we get a call. We get a call not via the telehealth, which we would love to use on a regular basis, but the good old-fashioned telephone. We tried to keep up with the patient as best we could. There came a point where Elizabeth was diagnosed as terminal, and her family said she would like her returned back to Hope. Later that week, when bed became available, we transferred her back to Hope into her hospice, where she required palliative care and peacefully passed with her family surrounded her. Her daughter flew out from Montreal, her children, grandchildren, all gathered in Boston Bar to celebrate the wonderful and colorful life that she had experienced. They were able to spend a few days from all over the country in beautiful, rural British Columbia, as I know many of you do with your family, friends, and loved ones. And so I would hope that anytime you, your family, or anyone in your sphere of influence are searching for a place much like this in a cold winter or stormy night, whether you're having chest pain, whether you're delivering a baby, whether you've rolled your car, or whether you simply have a burn on your tongue from your s'more that was too hot, I hope you can find a place that's open 24/7, 365. I hope that the paramedics are there to help you get you into this place, that the nurse on shift, which is not her 6th or 7th shift this week, and the doctor's on call, where you're going to then receive full service, team-based care, and with whatever resources are available. And so whether you are going to come out and Jeep with me for the weekend, whether you decide that you're going to come out and visit your family for the month, or whether you decide that after my talk you will kind of work with me for a lifetime, I will leave you with the things that I hope for rural healthcare. Firstly, I hope that out in the wilderness we continue to make a priority of accessible healthcare by sending those damn doctors and nurses out to give more patients more diseases. I hope that we make sure that connection is crucially important to providing care in places where there isn't a lot of care. That includes that telehealth terminal, which I would sure love to be able to use. I hope that we send our most experienced paramedics out there to provide that care. And I hope, more than anything else, we continue to staff, recruit, and retain physicians, nurse practitioners, nurses, and paramedics to provide the exceptional care that Elizabeth got on that fateful day. Thank you.